Hey guys, it's Dr. Mike here. I'm gonna drain this guy's Hydrocele today. Obviously during a pandemic, it's hard to take these guys to the operating room and you have to justify going to the operating room, but from his perspective, he has a large Hydrocele or a medium-sized Hydrocele, which is uncomfortable and he wants to have drained. He also is on multiple blood thinners, and so we just want to play it safe, and so that's why we're gonna drain him under ultrasound today. You see all the fluid we're talking about here around the testicle on ultrasound. Take a couple pictures. I can show you the nice blood flow of the testicle here. And then what I always do is I'm gonna just numb them up. You saw me paint them a little bit, pinch. So we numb up the wheel. Now there are a few different ways to drain these things, which we can talk about. You can drain it by just sticking a needle in, which we have. So if you imagine, just drain it by sticking the needle in. You see my needle? You can see my needle moving there. You don't want it to hit the testicle. See how it's draining clear fluid? Or you can put a syringe on and aspirate out the fluid. I think you end up with a little bit more control this way, especially in somebody that is on blood thinners. The key is if you ever see blood in the fluid, you just stop to limit your chance of getting a hematoma here. Obviously, we know that hydroceles come back, but at the same time, and some guys will inject stuff into here to try to prevent it from coming back. But at the same time, during the pandemic, this is probably the safest, easiest way to do these things. And we'll be done in about a minute more. So you see how my needle is there still? And there's no more fluid really to drain. So we're done.